The state of Illinois is ready to expand the massive COVID-19 vaccination beyond the healthcare workers starting tomorrow.
More than 3 million people in the state will be eligible for a shot in the arm Monday, but it may be weeks before they actually get one. WGN's Mike Lowe is on the city's north side with more. Mike.
Tamon and Jackie, good evening to both of you. We are at Harry S. Truman College. This is one of 6 sites that the Chicago Department of Public Health has set up at the city colleges as mass vaccination sites. Now, you will still need an appointment to get a vaccine here, just the same way you'll need an appointment at your doctor's office or at a pharmacy. But public health officials are cautioning people to approach the vaccination process with patience. They say right now there simply is not enough of the vaccine to give it to everybody who wants a shot.
The model for COVID-19 testing is actually quite simple, and that same model can be applied to the vaccination.
At St. Agnes of Bohemia Parish in Little Village today, as the community is taking COVID-19 tests, leaders are pointing out COVID-19 vaccine challenges.
What you see here today around you in this facility is the model for what we hope can be the culturally sensible and equitable way for distributing the vaccine.
It was a call for the equitable distribution of the COVID-19 vaccine, especially to communities of color that have seen higher rates of the disease than other parts of the city.
I represent the Belmont-Cragen community, which has a positivity rate almost 18%. Our community is filled with essential workers.
Phase 1B will allow people 65 and over and a specific group of essential workers, including grocery store employees, manufacturing laborers, daycare, school staff and teachers, public transit employees, agricultural workers, and postal workers to receive the vaccine. Phase 1A will remain open, allowing for healthcare workers and those in long-term care facilities to continue to get their shots. Governor J.B. Pritzker says 3.2 million people are eligible, but the state will have only 126,000 doses from the federal government next week, meaning in the first week of Phase 1B, less than 4% of those eligible will be able to get a shot.
Vaccine supply is limited all across the nation. There are additional vaccines in the pipeline that may soon see FDA approval, and that will help.
Most people will register for shots through their pharmacy's website. Right now, Jewel Osco, CVS, and Walgreens are the first to roll out registration pages in Illinois.
We do not have anywhere near enough vaccine to vaccinate anywhere near the number of people who are going to want to get vaccinated beginning on Monday.
In suburban Cook County, the National Guard is assisting with mass vaccination sites, helping to dispense more than 3 times what the healthcare workers would be able to do on their own.
We're really happy to have them here to push this out.
And at churches like St. Agnes of Bohemia, people are hoping the vaccine will come to them too.
Because we've cried a river and we prayed to God, and now the medicine has arrived.
And it is worth noting that it was exactly 1 year ago today that Dr. Allison Arwady announced the first case of the novel coronavirus here in the state of Illinois. It was a Chicago woman who had traveled to Wuhan, China, and come back. And now here we are a year later talking about a mass vaccination effort. Many observers call this a scientific feat, even if we do have to wait several months before many of us are vaccinated.